Welcome, I'm Dr. Carolyn Jacob, board-certified dermatologist and director of Chicago Cosmetic Surgery and Dermatology. Today we're here to talk about Sofwave technology and how it can help you and your skin get the lift you want to have. Please stay on the program until the very end because we're going to be answering all sorts of questions for you. And in addition, for those who book online at chicagodermatology.com, to get an evaluation for Sofwave by August 31st, they're going to $500 off their Sofwave treatment and a Trihex Duo kit, which includes Elastinectar and Restorative Skin Complex, a $200 value from Sofwave Technology Treatments. Sofwave uses parallel ultrasound technology, a very novel energy-based device to involve getting lots of collagen production throughout the middle layers of the skin. This is the only device that does this, and they've got the histology to prove it. We love Sofwave's technology because it's non-invasive. There's no downtime with it. Patient gets results that they're very happy with. And we can do this treatment over and over to continually improve patients' results with lifting of the jawline, the arms, even above the knees. Sofwave uses its unique patented technology to create parallel beams of energy going through the mid portion of the skin, creating new collagen in the area that's most important, the dermis. We want to have thicker dermal skin to give fewer wrinkles and more lift. And this is the only technology that targets the middle portion of the skin without any downtime or any side effects afterwards. It makes it a really great treatment for our patients because they can go right back to work afterwards knowing that they're going to enjoy thicker, better collagen and better looking skin in just a few months. Sofwave is a very versatile device in that we can use its technology to improve lifting of the skin, especially along the jawline underneath the chin, but also of the arms above the knees and those crepey areas that you don't like. And it's also approved for treating of cellulite and also acne scars. So again, one device that can do multiple different things for our patients to improve their skin. Sofwave parallel ultrasound beam technology is best for any patient who wants to get lifted skin, a better jawline, better looking skin, and improvement of the skin on their arms, abdomen, thighs, above their knees, or even acne scars. Truly, it can be used on all skin types safely, which makes it a wonderful, versatile device. For our Sofwave patients, we apply a topical anesthetic for about an hour prior to their treatment. The treatment may take anywhere from 20 to 50 minutes or so, and you leave the office glowing. You, in fact, don't have any true downtime with this device because it's not breaking the surface layer of the skin. The collagen contraction and development of new collagen does take several weeks, so I tell my patients to wait for about 4 months before we evaluate them for an additional treatment. They should be seeing thicker, healthier skin by 4 months after their treatment. So let me take a look at your neck here. Look straight ahead for me, if you will. And I'm just going to touch your skin here, if that's all right. So you have a little bit of skin laxity that's just starting to show between your cheeks here and the area underneath your chin, and a little bit on the neck too. And that's normal for your age. But what we want to do is we want to get ahead of it. So as we get older, you lose 1% of collagen per year after age 20, and they don't tell you about that. So what we want to do is we want to grow more collagen and elastic tissue for you. And one of the easy ways to do that is by using Sofwave parallel ultrasound technology, because what it's going to do is it's going to take the ultrasound energy, go specifically to a middle layer of the skin, cause new collagen to form in many places there, which gives you stronger skin and a bit of a lift. So that's going to help along the jawline here, a little bit under the submentum here, and also lift the neck. And it's one of our favorite things to do. There's no downtime with it. There's about an hour of an anesthetic beforehand. On a scale of 1 to 10, it feels like about a 2, except right over here on the bone, it might be a 3 or a 4, but it's very, very fast to do. We kind of just do talk aesthesia through it as well, so it'll be over with before you know, but it may take about 30 or 40 minutes to do it. The other places that we want to take a look at is, let me see your arms here, because this skin under here, your skin tone's pretty good, but this starts to get saggy in this area and starts to get crepey. And this is also one of those places where we want to think about getting ahead of the game first. Treating this to try to keep that skin tightened, because the skin starts to break down on the upper arms from usage and everything fastest. And if we can get more collagen here, then we can kind of keep this taut, perfect skin that you have. So some of what Sofwave is doing is regenerating new collagen, but we're also trying to get ahead of the curve and prevent the aging of the skin in the first place. So we usually use this in combination with some creams that are going to also help to generate collagen and elastic tissue for both the neck, the face, and then also for the arms. So there's kind of things that you do at home and things that we do for you to make everything look better. The results from the Sofwave can take up to 3 to 4 months to see, so be patient with it, because you're not going to visualize this kind of lifting effect overnight. It's going to be nice and gradual. Yeah, right. But it's going to be nice and gradual so that you have improvement over time. And then we'll probably be repeating the treatment on a regular interval. It might be every 12 months, might be every 9 months, just depends on how well your skin is holding up with its aging process.
Okay, sounds great.
Do you have any questions at all?
Just, I think you answered them in terms of like, how painful is it, what I can expect in terms of timeline, but no, I think that's really helpful.
Well, you'll be pleased, and you'll be pleased when you're done, because you can go off and do your normal activities right afterwards, which makes it really great for busy women as well.
Fabulous, I love it.
All right, we'll get you scheduled then. Thank you for joining us for this educational portion of learning about Sofwave technology and how it can help you with skin lifting and rejuvenation. Be sure to stay on now, because we're going to be going over your questions and answers. That was great. All right. So I hope everybody learned a lot from our video regarding the Sofwave parallel ultrasound beam treatment. And I'm here today to answer any of the questions that you may have regarding Sofwave treatments. We've been doing Sofwave in our office since 2023. So we have a lot of very, very happy patients who have come to get their treatments done and have had repeat treatments done, because as we know, your skin is a living organ, and it's constantly kind of growing collagen, but also breaking it down slowly. So we want to ensure that we continually give the ability for the skin to enhance more collagen over time. And that's what the Sofwave helps us do. So keep giving that lift, and depending on your age or your skin texture and quality, we'll let you know how many treatments are going to be best to benefit you and how often those need to be performed. So it can be sometimes more than one treatment every 4 months, possibly separated by 4 months. Some people will do a treatment every 6 months. So it really kind of depends. And that's part of the reason that we do these Sofwave consults, to see you and examine you and your skin, because every person is slightly different, but they're all candidates for having Sofwave, because there's really no contraindications with this parallel beam ultrasound treatment. So let's see. We've got a lot of people invited. I got to scroll all the way down here. Woohoo. All right. So cost, excellent question. The cost varies on how much we're performing for you. So when you come in for your complimentary consultation that you're going to sign up with us as soon as you're done with the meeting today, or maybe tomorrow, you can give us a call or go online. You will be given that quote for the cost depending on what we're doing. So sometimes we're doing the entire face as well as the jawline, the area under the chin and the neck. For other people, we may only be doing the lower face through the neck. We almost always recommend doing the neck along with the face. Why? Because the neck is a thinner area that breaks down faster and shows age faster. So we oftentimes are doing these treatments again to the neck as well as parts of the face, and the cost will vary on that. How many treatments are needed depend kind of on the quality of your skin, your age, and where you're at in terms of other treatments that you've performed. So I know some of you out there have had other treatments done for your skin and have really good quality skin for your age group. You might need to have a treatment done once a year. Others of you have a little bit more sagging and a little bit more skin quality issues, and we might do one and then do a second one in 4 months and kind of see where we get. We typically choose to separate them by 4 months. Why? Because sometimes it takes that long to see the results from the treatment. And what you're going to notice is a lift, less sagging of the skin, and improved quality of the skin. So all of you who signed up today, thank you so very much. And I know some of you are on and some of you are going to be sent the video afterwards. We have your names and your information, and we're going to be sure that you get the $500 off of the Sofwave treatment if you are able to book your treatment by August 31st. And why do we say August? Because again, this treatment has no downtime. So the lovely thing about it is that you can get this done and you can leave and go on about your day. And it won't interfere or conflict with any of your busy social life or any of the work that you need to get done. There's really no contraindications for patients. It can be done on skin of color. It can be done on younger patients as well as older patients. We start losing collagen at 1% per year at age 20. So no one tells us that when we're 20. So most people start to notice some of the skin laxity and sagging in their mid to later 30s. Somebody want to know, can we use it on the forehead? And definitely we can use it on the forehead. On the forehead, we're doing it to actually help to lift the brows up a little bit, because as we lose volume, our brows start to go down. So the forehead treatment is included with the full face treatment as well. Someone wanted to know if it was going to hurt at all. And I spoke a little bit about how we manage what you feel. I've had the treatment done myself, so I can tell you we put on a topical anesthetic for about an hour beforehand. That topical anesthetic alone is probably enough, but we also add in what's known as the Zimmer chiller. So the Zimmer chiller blows some cold air onto the skin to distract you during the treatment as well. And when Nirali was doing my treatment on a scale of 1 to 10, it was about a 2. And a couple little spots along the jawline are maybe a 3 or a 4 out of 10. So it's a very comfortable procedure in our office because of the way we do it and because of the anesthetic topical cream that we put on for you. It's really like no other. Patients are very, very comfortable for this. So if you already have a Sofwave scheduled for August, can you get this amazing discount? You are here. So if you are here, you're getting that discount. So I'm very glad that you did that. And please let your friends know all about your experience afterwards. So I'm extremely confident about this new technology. Someone was asking, Lauren, thank you for asking that, because as a scientist and a researcher, I have seen the actual, what I mentioned in the webinar, what's called histology. And what histology is they actually did biopsies of the skin to determine how much collagen was growing in the skin after the treatment. So you can actually see a difference in the collagen and the elastic tissue with new bundles of collagen and elastic tissue after the treatments. And that's the positive proof that we need as scientists to see that we're having those interactions and those changes truly occurring within the layers of the skin that we want it to. Now, someone wanted to know about, is it similar to a brand called Ultherapy? And it's similar because they both use ultrasound, and it's completely different because this is parallel beam ultrasound. And what I mean by that is that the beams of energy are put through the mid layer of the skin. Why is that important? Because that is where most of the collagen is located, and the cells that make collagen are in that middle portion of the skin. The other device that we don't have, and I never got because it hurts too bad, was shooting the ultrasound beams downwards, and it went too deep, and it hit areas that weren't going to help produce a lot of collagen. They were hoping that it would tighten a little bit, but it became way too painful. So this is much more precise, allows for the growth of new collagen exactly where we need it, which is within that dermis, that second layer of skin where we want it. And the best thing is, not only can it be done for any color of skin, it can be even done for people with rosacea, people with sensitive skin, people who have skin imperfections. All of those things can be discussed in your consultation because they are not a contraindication to having the treatment done. The device also uses no drugs, no chemicals, no needles. So it's just energy from ultrasound. And because of that, even people who have allergies to fragrances can have this treatment done as well. So again, something to discuss in your consultation. The only creams that are used are the anesthetic cream, which has no fragrance to it. I've even spoken with the lead contact dermatologist at Northwestern, where I am a professor at Northwestern, and they said that our topical anesthetic doesn't have anything in it that you can be allergic to. In the studies, patients saw lift, and they were very, very happy with the results that they had. There were differing amounts or percentages of lift that were seen throughout the studies, and it depends on if the studies were on the arm. So for instance, on the arm, they were getting 30 to 40% lift and a decrease in the crepiness of the skin on the inner portion of the arm. That's what was tested in that study. Same results above the knees. So some people don't like those little lines above their knees. We can give some lift to that area as well. And this can definitely work for people who are over the age of 50. I'm over 50, but we've even been doing it for patients over 60 and over 70. The only challenges are that if we're starting something when you're over 70, you have less collagen to work with. So we may be doing more than one treatment or a series of treatments to better benefit your skin. But as long as you've got collagen and elastic tissue, we can improve it with the ultrasound. That is the Sofwave treatment using that parallel ultrasound beam technology. Someone else wanted to know if it includes under the eyes. Yes and no. So we're able to take the device. It looks like that little bar, you saw it in the video. We're able to take it to the bony areas of the cheek and the bony areas of the forehead. So we may do a little lifting to treat a little bit over the brow. It won't hurt the hair. It won't hurt if you have nanoblading or microblading done. It doesn't do anything to color. And we'll lift it up, but it has to be over the bony prominence. So we cannot do this treatment all the way to the edge of the lid, of the lower lid, but definitely we can do it in the cheek area to help improve and lift that area as well. Again, this technology has had multiple clinical trials performed on it. It's been available since 2023 or 22. And again, we've been using it a lot since we bought the device. It actually, within 1 year, became our number one device that was used in the office because of patient satisfaction, because of lack of downtime, no recuperation from it, and also because of the ability for it to be comfortable during the treatment. And the other thing I want to remind you too, for those of you who are on today, make your consultations as soon as possible so then we can book you in to get your treatment done before the 31st of August. We are here Monday through Friday, and we'll get those consultations in for you. But you're also going to get an elastin Trihex Transition Duo. What is this? It is 2 creams that are very important for you to use for your skin, and I want to explain why. Number one, there's a product in there called Elastin Nectar. And for those of you who don't use Elastin Nectar, you've not been to my office or had a treatment done, because Elastin Nectar helps to improve everything. It helps to grow new collagen, new elastic tissue. It helps with plumping of the skin, and it helps recovery from even the lasers that we use that do have some downtime. But when we use it in conjunction with the Sofwave technology, it gives you better results. That's the short story of it. We would be having you buy it normally, but you're going to get it for free. And then when you're done with the bottle of nectar that you use 2 times a day, you're going to switch over and transition over to the Elastin Restorative Skin Complex. The Restorative Skin Complex is now your everyday cream that you're going to use to continue that process of generating collagen and elastic tissue. So you're going to continue on with these wonderful elastin products that will help to further benefit your skin long after your Sofwave treatment is done and to boost your Sofwave treatment as well. And the one other thing I want to keep in mind, for those of you who are here today, we are going to be putting your names into a raffle to get your own little kit of elastin treatment products, including my favorite Elastin C Radical Defense, the only vitamin C using vitamin C ascorbate. That particular type of vitamin C does not smell, does not go bad in the bottle, does not sting when you put it on. It comes in a pump. The bottle lasts for about 3 or 4 months, and it helps to preserve your elastic tissue. This is very important. Other vitamin Cs that are out there do none of these things. So it is the #1 vitamin C that's the safest and best for your skin, but also the most stable version that's going to help to retain and improve your elastic tissue as well. So for all of you joining us tonight, you're going to be entered into a raffle to win a package of elastin products, including the C Radical Defense, one of their moisturizers, etc. So it's all good. And then in addition, when you come in to get your treatment done before August 31st, we're going to give you that transition duo. So let's see. Someone else asked, are there contraindications? There aren't any contraindications because this does not have anything that needs to absorb the energy. So it is great to use on any skin type, from skin type 1 to skin type 6. The heat is low and slow. It does not cause, and it's deep, so it does not cause any discoloration to the surface layer of the skin. It's been shown in studies that it will also help out with some fine lines on any type of skin that we have as well. And again, we've got before and afters on our website. We showed some today. We can show you some when you come in the office. But again, it's going to be safe to use on all skin types because it doesn't cause too much heat to damage the color of the skin. And it doesn't cause any aftermath to the skin that might lead to any contraindications, such as some lasers do. Someone had a wonderful question here, Anne. Thank you for asking. Does it affect plastic surgery down the line? The answer is no. Your plastic surgeons will thank you because we love our plastic surgeons, and what they can do is underneath the skin. They're pulling things that are underneath the skin. We need to make the skin stronger. And that's what we're doing with Sofwave. We're creating thicker skin, but it's not scar tissue in the skin. It's thicker skin that's going to be better as a something to drape over the work that a facial plastic surgeon might do in the future. So there's no contraindications to having any sort of lifts done if that's something that's necessary 20 years down the road from now. And the other great thing, thanks Paula for asking, fillers are not an issue, nor is neuromodulators such as Botox and Dysport and Daxxify. So if you've had those treatments done and you have filler, that's great. Your filler's underneath the area where this energy is going into. So again, the energy goes straight into the middle portion of the dermis. All of your hyaluronic acid, your Radi-S, your Sculptra, those are all going underneath the skin. So the energy from this superior ultrasound parallel beam soft wave treatment are not going down where those treatments have been done. Same thing for your neuromodulators. Those go into the muscle and into the nerves that drive the muscle action. And that is not where this energy is going. This energy is going straight into the middle portion of the skin. So it makes it a perfect treatment to complement all of those other treatments that you might already be doing. Rina had a great question regarding, can BBL and other laser treatments be done a few weeks or months afterwards? Let me tell you what I sometimes do in combination. I'll have patients come in and they'll have their soft wave done. We will then immediately do some other injectable biostimulators, And then we will also do surface treatments such as Fraxel lasers, such as the Exion radiofrequency microneedling treatment. We'll do them all on the same day. Why? Because they're all targeting different layers, if you will, of the skin, either the top layer, the middle layer, or from underneath. And so we can definitely do multiple treatments either on the same day or in succession with either Hero BBL, the Fraxel Dual, even CO2 laser could be done, and especially using our other treatments like radiofrequency microneedling or other injectables. Again, somebody wants to know how much the treatment is. That's a great question. That's why we have you come in for your complimentary consultation. Those of you here seeing this video are going to get a complimentary consultation because everybody's different, and the ranges go anywhere from, I believe, 3,500 down to 2,000, something along those lines. But again, if you signed up for today and you get it done by August 31st, we're going to be giving you $500 off. And when you come in for your consultation, we'll let you know exactly the same cost that it's going to be for exactly what you personally need. And then someone want to know if they can have other treatments done the same day. Absolutely. This is treating that middle layer of the dermis. So anything we do above or below it could also be done on the same day. And if that's something that's important to you, say you're coming from a long distance away, it's very easiest for us to follow and figure out exactly which treatment goes first. Typically, the Sofwave goes first, and then the other superficial or deep treatments go on afterwards. After the treatment, do you need to avoid the sun? So we love the sun. We love our summers here in Chicago. We want you to be out and be happy and enjoy the sunshine, but we want you to be protected at all times. So we always have you protect your skin with sunscreen containing zinc oxide. There's some amazing different varieties of sunscreen that we provide for our patients that are also anti-aging or that are also ultra protective. Not all sunscreens are the same, and we want to ensure that you have the best protection for your skin, and we want you to protect your investment. So we want to make sure that you've got good collagen, good elastic tissue, the right sunscreen for you. And we'll also go over that in your consultation as well, because that's an imperative part of what you do at home to preserve the health and the longevity of your skin. So you don't have to avoid the sun. You just have to be using your appropriate sunscreens that we've recommended to protect in the best way that you can. So go out and enjoy, but reapply that sunscreen, get some beautiful hats and sunglasses to protect that skin, because we do know that the sun does break down collagen elastic tissue. That's why people get more wrinkles who live in sunnier climates or climates that are closer to the more elevated, closer to the sun, such as Denver and in the mountains. So wear your sunscreen. We'll tell you which sunscreens are perfect for your type of skin as well. And then again, there are no contraindications for age for any type of devices, even like implantable devices. If somebody had a pacemaker or somebody has any metal plates in their skin, none of those are contraindications because this is ultrasound. It's using sound therapy, but in a much better way than the previous devices that you may have heard about. This one does much, much better with almost zero pain. Again, a 2 to 4 out of 10 on the discomfort scale, and some great results for our patients. It's not going to fix everything, but in your consultation, we would talk about other things that are helpful for the things that if Sofwave isn't the perfect answer for that particular area to be lifted, we'll let you know. Because again, we've got lots of different types of devices that can be complementary to the Sofwave parallel ultrasound treatments as well. And malar festoons, somebody want to know about those. That's a very specific question. I encourage you to come in and let us take pictures and look at them, because everybody's cheek pads and fat pads are different. If you need to have a fat pad treatment or have cheek pads that are in the way, we can take a look at it and see if Sofwave is the right answer, or might be Sofwave with a combination of other things. And then someone asked about preference for Fitzpatrick type 5 and 6. Again, this is perfect for any skin type. So we would recommend that you come in for that consultation so we can let you know exactly what's great for you and all of the different features that you have, because we take a lot of pictures and we have a lot of different views to understand the best treatments for what you need for lifting, for if there's any reason to relax things, if there's any way to restore volume that needs to be done.
Someone wanted to know about how M-Face works with Sofwave, and that's a wonderful question too. M-Face is a great treatment using high-intensity focused electrical stimulation along with radio frequency. And those two energies together can help to tone muscle and lift muscles, as well as improving the texture of the skin. Apples and oranges, these are both amazing devices. We have done studies on the M-Face device, and there's 3 different ways it works. It can help to lift the cheeks and the forehead by toning the muscles. It can also get rid of fat underneath the chin by using a different energy of wave radio frequency level. And then it can also be used to tone the muscle underneath the eye to prevent eyelid bagging. That's a whole different ball of wax than what we're talking about with the Sofwave, but they complement each other beautifully. So you can get M-Face treatments done for one set of reasons, and you can get Sofwave done for the lifting and the improvements that we're going to see with that parallel ultrasound beam technology. So thank you for asking that as well. Are there any other questions? That was a lot of really good questions. All right, so here's what you need to do. Remember that you need to go online to chicagodermatology.com and click that Make an Appointment button. You can make an appointment for a Sofwave consult with any one of our very highly trained physicians or physician assistants. Get your complimentary consult done, and we'll get you scheduled. If you get it scheduled before the 31st of August, then we're going to give you $500 off. The treatments take about, you're here in the office, maybe an hour and a half. Why? Because we're putting that topical anesthetic on your skin for about an hour, and then the treatment itself might take anywhere between 20 to 50 minutes. So I would book out at least 2 hours of your day, but you can bring your computer with you or do anything you want while the topical anesthetic is on your skin. And again, they can be done in combination with other treatments, but we'll settle and work all of that out during your consultation, which is very important to have a consultation to understand all the nuances with this particular treatment and what you exactly need, because everybody is different. So, and then somebody wanted to know if you could do the consult and the treatment on the same day. Most likely we can, because there's no contraindications to this treatment and there's no downtime to this treatment. We just have to ensure that we maybe give you a phone call. If you want to have that done, one of our concierges can give you a call, walk you through it. We'll look at our schedules, and we'll certainly make that happen for you if that's something that you're interested in doing. Thanks so much for the extra questions, everybody. All right. So if that's all the questions we have, please make sure to go to our website, chicagodermatology.com, go online and book an appointment for your consultation. You can also call us, and we'll be happy to take care of any of the questions that you might have at that consultation. So just make sure you come in to see us so we can see you, get your pictures taken, and know exactly what it is that you need for your skin and what would be best for you and how we can best help you with Sofwave. We're really thrilled to be able to give you this information, and I love lecturing on it. I also lectured on the Sofwave technology at our recent Innovations American Academy of Dermatology meeting that was here in Chicago this summer. I'll also be talking about it at our cosmetic bootcamp meeting coming up in August, and also spoke about it at another cosmetic meeting in Nashville. So there's lots of education that we get to give everybody, and we're thrilled to do this for you. So any questions you have, we are happy to answer. So thank you all so much for joining us tonight. And for those of you who couldn't join us, we'll be sending you this video so that you can review it. And please give us a call. Go to chicagodermatology.com, set up your appointment, and we look forward to seeing you. Thank you, everybody.